Well, hello everybody and welcome. My name is Mark Dixon. I am here to help moderate the event for the HS Spotlight tonight. Tonight's session is it's quite a hot topic. We're going to cover cannabis and HS with Dr. Barry Resnick and Paul Wiseman. Dr. Resnick is the medical director of the Resnick Skin Institute of Ventura, Florida. He graduated from Tulane University and completed his residency in dermatology at the University of Miami School of Medicine. Dr. Resnick has a special interest in psoriasis, vitiligo acne, and hyperhidrosis. He is also an acknowledged expert in the medical and surgical treatment of HS. Dr. Wiseman has trained in emergency medicine, dedicating himself to those in need of medical attention in an acute care setting. He specializes in endocannabinoid system. Dr. Wiseman helps patients attain their best health for their disease or chronic pain. He created the ZC Concierge Cannabis Center, an innovative approach to medical marijuana. ZC is a comprehensive, all-inclusive medical cannabis program that allows each patient to obtain the maximum benefit from his or her medical cannabis therapy. So thank you both for joining us tonight for what is bound to be a really informative session. And I'm going to turn it over to both of you guys to sort of continue the intro and kick this thing off.
Great. Thank you so much. I'm glad to be here. I practice in Miami, Florida, and I've been a dermatologist for over 30 years, and I do all the different things that HS patients need to be done to gain control. And while Paul is working out our little stutter for technical issues, I think it's important whenever we're talking about HS, whenever we are talking to patients with HS, or when we're talking to people who care about them, it's important to understand what HS is and isn't, because everything that you have been told about HS probably is not as accurate as you'd like. So I begin this little process every time I see a new HS patient by telling them what HS is and what it isn't. HS is a disease of the skin only. It is not a disease of infection. It's not in the fat or the muscle. It is not sexually transmitted. It is not contagious. It's not from glands. It's not from hormones. It definitely isn't from being dirty or not washing enough. It is not autoimmune that we know of so far. All of these things are really important because when you do have HS, you need to understand the process. We have plugs in our follicles. Inflammation that comes behind the follicles explodes through the follicle into the skin because it can't dislodge that plug. And the constant explosion and healing leads to what you see classically as those scarred plaques. I call them ant farms in your underarms or groin or between the breasts or buttocks. It burns, it stings, it smells, it hurts, it hurts. So we're talking about pain today because patients with HS, whether they recognize it or not, and whether anyone else recognizes it or not, that you hurt 24/7, 365. And it's important to understand that. And the whole goal of control of the disease means we control the hurt, the burn, the sting, the smell, the pain. So we use lots of different things. I will use narcotics when they're necessary. I'm not worried about them. I'm not going to get you hooked on them. And I know that it's important that we have pain control. And sometimes when we're starting off, all we've got is pain. And we need to stop that so that you can have a breath of fresh air and understand that there actually is light at the end of this horribly dark tunnel that you've been thrown down for years and years and years. And we use other things. We use steroids, both oral and injected into spots. We also use them intramuscularly for a systemic effect. We use things like gabapentin, which is something that helps with neuropathic pain. We'll use topical anesthetics like lidocaine. So pain. And sometimes, even though the medicines that we use like Humira or Cosentyx or Remicade or newer ones like Bimzelx, they're going to slow or stop your drainage, your leaking, but it might not mitigate your pain as much as you want. So we're here to talk about cannabis and HS. So my friend Paul Wiseman, he and I went to college together. He has been my go-to guy for medical marijuana here in the state of Florida. He lives close to me, and I sent all my patients to him. He's got the inside track on cannabis, THC, the various ratios, and what he feels works best for people and why he thinks it works for some and not for others. So now I'm going to turn it over to you, Paul, and let you ramble for a bit.
All right, well, thank you. I had the privilege of seeing a lot of Dr. Resnick's various patients. And it started with our friendship and just speaking, and then realizing there's this segment of people that are being underserved. And when a lot of the patients come in, they're sent over for pain management. But as we go through the intake and the process, we find out it's much more than pain management. It's not only pain management, it's the social anxieties that come with it, the work anxieties that come with it, the stigma that comes from leaking in public, the poor sleep that a lot of people have. So we've been able to help people in many, many things. And what Barry and I talk a lot about is stress makes things worse. Autoimmune diseases get way worse with stress. And this is one of the autoimmune diseases which we see that causes a lot of stress. There's some that are inside that people don't see, but this is when you're going into public with. It causes severe pain in some people. It causes different odors in other people. And the stressors are huge. And anytime we can work with them and make it better, it's great. So believe it or not, a lot of people will come saying, I'm here for pain management. And by the time we talk about it, it's really looking at their pain management, their anxiety levels, their quality of sleep and the amount of sleep they're getting to set them up for the next day, and putting that all together. So cannabis is a new medicine for us. It's been around for 6,000 years. In fact, it used to be standard in the industry for physicians up until 1937. It was in our pharmacopoeia. We could write for it. And it got taken away by the Marijuana Tax Act. And then in 1972, unfortunately, it became a Schedule I drug, which to the government, Schedule I means it has no medicinal qualities. That's very different than a Schedule II drug, which is controlled but has medicinal qualities. So unfortunately, the research on cannabis stopped in the United States. There's a couple places that have licenses to do it. Mississippi has the main supply of the stuff from the 70s, but it's changed over the years. In Israel, Dr. Rav Himachum spent 60 years looking at this plant and doing research. Unfortunately, HS isn't big on the list of what we're going to look at first. They were looking at pain control, how it works, trying to undo this plant. This plant has many, many chemicals in it that can be good for you, that can be used, but primarily we break them down into two parts, the CBD part and the THC part. And they do different things and they do some of the same things. What's impressive about this is every one of us is born inside with an endocannabinoid system, meaning inside cannabinoids are the THC and the CBD and the parts of the plant. And we have a receptor system that matches this plant. We were born with it. It's not like big pharma is trying to make a medicine that reacts to our receptors. The list that Barry talked about earlier, those are medicines that were made to work with our receptors that we have. Nature made this plant. Now, it is not a one size fits all. It is, I would liken it more to finding the spaghetti sauce that you like. Everything has different ingredients and you have your receptor system, and it's a trial and error medicine where you try different levels of CBD, different levels of THC, different combinations together to see what works best for you and at the time you need it. Also, not only are there different ratios you can use, but there's different ways of using it. It can be an inhaled route, which is quick acting, works very quickly, and only lasts 2 hours. It could be a sublingual route, which means you absorb it in your mouth. It could be a sucking candy, some drops, and they gave them a fancy name called tinctures. Still drops. They work in about a half an hour, but they give you 4 or 6 hours of continuous relief. And then there's edibles. Everybody's always talking about edibles because it's kind of a mystery. People make their own brownies or they make their own cookies or they get gummies or chocolates. What's interesting about whether you do it that way or in a pill form, when you ingest it and it goes in your stomach, it has to be digested. Once it's digested, it'll go through your liver. It actually gets changed to a more potent THC. It goes from what's called Delta 9 to Delta 11. So there's a delay, and then it hits a little stronger, but it lasts longer. So it's kind of the thing, quick in, quick out, and we can use according to how you need it. So when we teach people to use this, we're really teaching them how to experiment and ask your body, does this one work for me? Does this ratio work for me? Does it work for me at this time, or is it too much or too little? And you can adjust it to your life. That's why I always suggest that people keep journals, whether they're starting with over-the-counter CBD, which we'll talk about in a little bit, or they're going to in a state that has recreational cannabis or a state that has medical and recreational cannabis. You need to write down exactly what you're taking, and then you need to write down also where you bought it. So I always tell people, write down what you took, the way you took it, how you felt, and where you bought it from. Where you bought it from is actually important. Like here in Florida, they have licenses for dispensaries, and they have to grow everything themselves and produce it, but they can start with the exact same seed, but they have different lights, different humidity, different fertilizers, different water, different systems to do it. And the plant is live. It keeps changing a little bit. So there's different personalities of the plant. The amount of THC may change, the amount of CBD may change. And then you can hear terms like terpenes, which are the personality of the plant and how they affect you, they change. So it's really an interesting medicine. Instead of just, here's a prescription, let's try it for a few months, let's make another appointment, tell me how you're doing. You can change things, change dispensaries in this state, and other states are different, and really fine tune what works for you. So the CBD side of the plant is interesting. You have all these receptors and they cross over between THC and CBD. And there's all these fancy names like CB1 receptors and CB2 receptors. You don't need to know all that. What you need to know is that the CBD part is more the anti-inflammatory, anti-anxiety, mild pain relief, like Motrin, without the side effects of Motrin and the GI effects and the cardiac and renal effects. The THC side, we use the psychoactive, meaning it affects this, but it affects nerves. We use that also for help. We use it for sleep. We use it for pain control, like you use narcotics. Different though, that you don't get the same constipation. You can get dry mouth and get a little bit of constipation, but you don't get that same narcotic effect. Now we use it for that. We can use it for anxiety in the short course. We can use it to stimulate appetite. What's interesting is some people, when they get stressed out, about 10-20% of the people actually stop eating. They don't eat. The other 80%, unfortunately, like me, start going for chips or ice cream or comfort food, because you're trying to change your physiology to change the way you feel. It's the only control we have, which is interesting. So sometimes we use the THC part of the plant to actually stimulate people's appetite, because if you have an underlying autoimmune disease and or infection and or cancer and or anything, and you're underweight, that is way worse, in my opinion, than being overweight, because you can't make the things you need to make to fight these diseases. You don't have the substrate. So, any questions real quick? Go ahead.
So using all of that knowledge, what's the plan that you try to institute when you see one of my patients for HS?
Right. So after telling them they've got the best doctor, because they're your patients, and I truly believe that, and you give so much, but I truly ask them about their pain and their pain level, when it is, how it's affecting them, how's their sleep, because a lot of people are losing sleep. You don't even realize how this affects people. And then we work it backwards, actually. We start with sleep. Okay, let's make sure we can get you a good night's sleep. So when you get up in the morning, you're fresh. And we'll work on that. Some people have trouble falling asleep. Some people have trouble staying asleep. And some people have both. So depending on if it's just falling asleep, they may use something, inhalation or some drops. If it's just staying asleep, usually I'll have them take an edible about 2 hours before they want to go to sleep. So it kicks in about sleep time and it helps them drive through the night. And then if they have both, then we use a combination. So once we kind of clear that off the board and try to see that, and Also, if anybody has an underlying sleep issue like sleep apnea, we'll suggest that and suggest a sleep test to make sure we can maximize that part and then move them to the day. Then during the day, it's very much interesting because THC affects people differently. Me, I'm a cheap date, I'm a lightweight. It takes very little THC from my receptors for me to feel it. Other people can be 5 feet tall, weigh 90 pounds, and they can use much more. So depending on how people react to the CBD part and the THC part is how we start designing this. So usually I have people start on a weekend so we can start figuring this out. And then I usually have people take some CBD products during the day, just CBD, to see how it affects them. So they start understanding how their anxiety works and how their pain changes and how the inflammatory processes change. And as they're working through that, and usually it takes a month or two of good CBD, a good quality CBD, to start seeing the effects.
Okay, so CBD over the counter, CBD from the dispensary?
The answer
Both?
is
Neither?
it can be both. CBD from the dispensary in our state, we know, is coming in organic line. In other states, I can't speak for. When you go to over-the-counter products, there's a few good products that I trust out there that have consistently been. You and I have talked about Charlotte's Web, great companies, started with a little girl who unfortunately passed away a couple years ago, but they've done really well. Locally, I use a place called Holistic Hope in Fort Lauderdale. Alex triple checks everything because I always wanted to make sure everything was as clean as it could be and there were no other byproducts in. I would not suggest going to the corner gas station or someplace on where you see a Groupon where you can get like 1,000,000 milligrams for $9 because that's not a quality product. We already are having trouble. A lot of those have artificial dyes, artificial everything, artificial, you name it. You want a good quality product. So as you try the CBD, it gives you kind of window of how it affects me. And also for people that are working, for people that are driving, it doesn't have the psychoactive effects of the THC. Then the evening and weekends come, and that's where I get people starting to experiment. I love a product that's called a 1-to-1, half CBD, half THC, because you have all these receptors, and there's a fancy term called the entourage effect. Basically, if I tried to build a house, I could do just so much. But if all of us on this call, all 300 of us, tried to build a house together, we could do it much better. Well, that's what you're doing with the whole plant when you're using CBD and THC in the whole plant. I like whole plant extract because it has everything that nature provided. And so when you do this, you can figure out how much THC helps you and how much CBD, because in a 1-to-1 ratio in those little droppers, they call them tinctures, there's 20 milligrams per dropper norm. And so there's usually 600 milligrams in the vial. So 600 divided by 30 dropper fulls is 20 milligrams per dropper. And we know it's a half and half. So if you do the math, that's half CBD and half THC. So if you take a whole dropper, you're getting 10 and 10. If you take a half a dropper, you're getting 5 and 5. If you're taking a quarter dropper, you're taking 2.5 and 2.5. So people can get an idea exactly how it works. When you're taking a gummy or an edible, you're taking usually 5 to 10 milligrams, but it's being converted in your body and it's kind of hit or miss what's in that. And if you're vaping or using flower, which is great, it's still variable. So you can get a better titration using the drops. And it lasts longer. But again, they each work for what they want. And then some people need more. So some people will say, I'll take a little more, a dropper and a half. And they start seeing, oh, I'm taking 20 milligrams of THC because that's what it takes for me. They may switch to just a little bit of CBD and a lot bigger ratio of THC, like what they call a 1-to-9, 10% CBD and 90% THC. And so they can go up and down the spectrum and see how it affects them. Now, some people may find out that, oh, the THC doesn't really affect me that bad. It controls my pain, especially nerve pain. THC is really, really good for nerve pain. People with HS, people with diabetic neuropathies, all different neuropathies, they respond really well to THC. The CBD is great because it's the inflammatory part, right? So you're double dipping with one plant. And then you adjust. We get texts all the time. I have a great patient advocate, and we're always going back and forth with our patients. I tried this, I tried that, try this. And all of a sudden, between the different dispensaries and the way they do things, they start seeing patterns. And that's why the journal is important. You start seeing a pattern, and then you can start pick out, during the day, I'm THC sensitive, I use CBD, I use a full dropper. Or during the day, I can use a 1-to-1, half a dropper, and I'm good all day long. And then you start seeing the patterns and doing that. Now, remember, we were talking originally about pain, but there's more than just the pain. There's the pain, there's the anxiety, the social stigmas. And like when you talked about, we have these new meds that can really dry you up. That's awesome. But how do we control the pain too? And unfortunately, and I've had relatives that have been through the same scenario, by the time they get to Dr. Resnick, they've been told all sorts of terrible things. It's your hygiene, it's your deodorant, it's this, you didn't do this, you didn't do that. And then they got put on a bunch of steroids, and then they got put on different things. And finally someone said, oh, I know what it is now. And the stigma and the trauma of those can be years until they get to you. It runs deep. And so we work on all those levels, including their pain, to try to move it forward. And basically, we're trying to get to the best quality of life. That's the key for each individual.
For sure.
And we try to teach.
I have a lot of patients who have had that journey of 7 to 10 years of being told, nope, you're dirty, you're not doing it, you're not listening to me, you're not taking it, it's just an infection. And they are psychically scarred as well as physically scarred. So in my new patient packet, I've got Paul's information, I've got all these other things in there about intimacy and who to talk to about it. And I've got counselors as well, and mental health really contributes to physical health for patients with HS. And I've got plenty of patients who have finally realized that they can't walk this path alone, that they need someone like me, they need someone like Paul, they need a psychiatrist, and they also need a counselor. And cannabinoids and THC help and are used in conjunction with psychiatric meds, with anti-anxiety meds. So it's important to remember that this is a disease with a medicines deficiency. And typically when I start off with a patient, I'm talking medicines like doxycycline and Humira and maybe roflumilast and other things that I need to help reduce the physical signs and the pain. But we're also talking about things like anti-anxiety medicines like Buspar and things like Prozac and Paxil, antidepressants, because you can't walk this path alone. And something that we haven't talked about yet, understand that Florida has medical marijuana. Other states have medical marijuana, but the United States, as Paul's pointed out, still has not legalized marijuana. So I am sure there are people listening and watching this webinar who are in states where you can't get medical marijuana. So something that Paul had mentioned was Charlotte's Web. It's from a place called Realm of Caring in Colorado. And Charlotte was a little girl with status epilepticus. She was seizing all the time. And she was finally treated with this stuff, and it stopped her seizures. And I don't know if you've seen the report. Sanjay Gupta did a very large and long documentary on how she was helped by this. And Paul pointed out she passed away a couple of years ago, I think from COVID, but her life was turned around by this stuff. It is legal in all 50 states. It is available for purchase online. It is part of the information that I give to people. It's called Realm of Caring. The medicine is Charlotte's Web. It comes in a bunch of different forms. And as we're doing this stuff, we're finding that the more assistance we pull from many would think disparate places, it helps patients become whole. So if you don't have access to someone like Paul for medical marijuana, you need to ask around. You know, I called up Paul. I don't think he had much more than the idea of the name for HS when we spoke. I explained the whole process to him. I said, look, I don't want to have to recreate the wheel every time I send someone for medical marijuana to convince them that it is a chronic pain syndrome. I says, I got this. So people are out there for you to find. So in Florida, I'm sorry, I keep getting dive bombed by a mosquito. In Florida, how many dispensaries are there, Paul?
And numbers, well, I think we're well over 24, 25 brands of dispensaries, and they can have between 5 and 90 stores. So there's a lot of dispensaries around. They call them MMTCs, or medical marijuana treatment centers, which is interesting that the dispensaries are the treatment center and the physicians, the qualified physician. It's just the way they named it. So it's really, there's a lot here, and there's good quality here. The one thing I want to caution about is when the Farm Bill went through and they fixed the Farm Bill, CBD became legal across the United States. There was a little error in the way they wrote the bill, and all of a sudden you started seeing Delta 8 and Delta 9 pop up as that. That is a synthetic forcing of THC out of the plant. I do not recommend that personally. The chemicals they use, and it doesn't have the same effects or the same quality. The CBD is one thing, get a good quality CBD. When you start using Delta 8 and Delta 9, it's the Wild West out there. There's no regulation on it. In fact, in Florida, it will be illegal starting October 1st, I believe. It's being taken off the board. It was just a loophole in the law, and an industry obviously blossomed out of it. And those are the stores you see. Get your THC, no card required here in Florida and other places. I'm very concerned about what they use to make that product and how they make it. And I'm not so sure it gives the same relief that we've done without causing other problems. So difference between CBD and the Delta 8 and Delta 9s, those are synthetics.
Got it. Mark, we can take a second and see if there are any questions that have come up.
Absolutely. So Dr. Resnick, you're getting a lot of shout outs from patients out there. So I know you got a lot of grateful patients and people supporting you on this. I just wanted to let you know that. And Dr. Wiseman, we have an interesting question here. One of the participants says they feel they don't have any active cannabinoid receptors. They've tried using medical marijuana for chronic pain, but have felt very limited or no effects at any dose or in any form. And they were wondering if you could speak more or less about the medical benefits for HS, if they would still work for somebody in their situation.
Well, that's interesting. Again, that person, I don't know their history, or I don't know how much they were taking and what ratios they were taking and where the product came from. So there's a lot of variables in there. Some people take a large amount. They really don't get affected. And again, it doesn't work for everyone.
Yeah.
It's not that you have an endocannabinoid system that's not working. It's the fact that the way your receptors work, you require more or different. And so it's an interesting conversation because you're very limited in what works for you for pain. Narcotics, they only work for short term, and then your body gets hooked and you need more, and it has all the side effects, potential respiratory depression, and all the other GI side effects that go with it. Non-steroidals, same problem. So we're really trying to do this, and it's a hard question to answer. I wouldn't give up. That's my first thing. I wouldn't give up. I would go back and try to figure out what you're taking, the amounts, the ratios. If you're in a state where there are medical marijuana doctors that are good quality, and I would definitely try to find one that's does this because they enjoy it, not doing it because they're working for a clinic that's giving out cards. And when I start seeing get your card, that's not medicine, that's get your card. Find someone who really wants to work with you, but realize that the majority of the work is going to be done by you in experimenting and trying different dispensaries and different things. It's very interesting. I have a patient who's got something different, but very, very affected. And he was in my waiting room, which was interesting because he had terrible agoraphobia and they had to sedate him with Xanax the first time they brought him in. So I found him sitting in my waiting room on his second research. So he's 14 months into this, talking with everybody. And I'm like, whoa, that's really interesting. And they were saying, you're doing it wrong. He's like, how am I doing it wrong? I've lost 153 pounds. I stopped drinking, stopped smoking. My pain's controlled. Turns out I'm creative. I got a job with a gaming company. And his mother turns around and says, and he looks me in the eyes when he talks to me, first time in 18 years. Now, when he told people how he took everything and how he bought it, it was a little strange until you saw his journal and how he figured out. And sometimes he took more, sometimes he took less. And for this, his system required something completely different than I would have started somebody else. But for him, it was life-changing, right?
Yeah.
So I wouldn't give up.
Okay.
I would really get to another physician, take a look at what's in there, look under the thing, ask them which terpenes are in the product to buy. What's the ratio of THC? What's the amount of CBD? How is it processed? It may be a processing thing, it may be roots. So you have to try different things.
And
Yeah,
it sounds like the journal is really important.
Yeah.
I think, being able to monitor and track sort of times a day when things are working, that really makes that personal experience, better for the patient. I have a question, sort of about, folks who are having this conversation maybe with their doctors, and getting past maybe the stigma that's out there traditionally about talking about this and the sort of medical community, the dismissiveness of it. And how do you sort of break that barrier? And there's that kind of segues into another question that a participant asked here of, how do you find somebody like yourself, Dr. Wiseman or Dr. Resnick, who is comfortable with, getting their patient on this? And how would somebody go about finding, people in the medical industry that are advocates for this type of treatment plan?
So, there's that saying, hang up your shingle, do something well, and people will come. When you're looking for someone who's going to help, I think the first and greatest resource are the HS support groups, because you've got a lot of people sampling all the doctors in a particular area. And while you may not have a lot of people in your particular area, you're probably in a situation where you can activate that and see who shows up. Perhaps they do virtual visits. And I don't want this to sound like a commercial for me, but I think it's important as a physician to be as available as I can be to all of the different patients that I see for all of the different issues that I deal with, because if I'm not available, can't help. And I'm an older guy, man. I am 60. And to bank yourself on to use only reviews as a way of deciding who to see, I think is a bit short-sighted. I think that talking to your primary care physician, if you have a good relationship, and all of this is predicated on whether you've got a good relationship. If you have been so marginalized, there's that mosquito again, if you've been so marginalized and so dismissed, you're probably not going to be very trusting of any physician. And someone who comes to you through the support group or through someone else who you trust, I think it's going to have an easier time of gaining your trust. It is a difficult road out there. I know that the standard is 7 to 10 years of non-diagnosis seen by 7 to 10 physicians and health givers. And that just blows my mind. I mean, for me, this is what we would call a doorway diagnosis. I step in the doorway, I see it, that's what it is. A duck's a duck. So that's a multi-factored question. But the bottom line is that you've got to find people who are trusting of that person for you to be able to trust as well. And what was the second question?
Yeah, and I think the second question was really sort of around, I guess, from a patient experience, how do you talk to your doctor about this, or how do you make it comfortable to broach the subject of trying to get access or gain access to medical marijuana and cannabis products for pain management that when traditionally it's so stigmatized.
Right. Let me field this one. So I believe the healthcare professionals are part of your team. Like Barry was talking about, it takes a team approach to get through a lot of diseases. It's just not pain management. It's medical, emotional, psychological support, all these things. You have to create your team. To me, I used to get this question all the time. What happens if my doctor says they won't see me? This, and I used to hem and haw. Now I just say, listen, it's your life, your team. We're part of it. You pick and choose who's on your team. If they don't support you, get
someone else.
who does.
Yeah.
Find someone who does. Listen, if someone tells me that every morning getting up and doing some meditation and spinning around 4 times sets them up for their day, who am I to argue with that? That sets them up for their day. Whatever it is, there may be something I totally don't even understand going on in their ear, but it sets them up. So I really believe there's a lot of information. There is a stigma to this. I find it very interesting that over the last 7 years, people would say comments and things, and all of a sudden 3 years later, either they're sick or someone in their family's sick, and they're knocking on my door saying, can you help now? Right? It's new. Unfortunately, when I trained in the 1980s, eggs were bad for you. Marijuana was the devil's drug, and alcohol was going to extend your life if you drank a glass of wine or had a shot. Here we are 40 years later, eggs are the superfood. Marijuana has medicinal qualities, and there's nothing medicinal in alcohol at all. The studies from COVID on, everyone, one after the other, and especially when we talk about an inflammatory process, you shouldn't be going anywhere near alcohol. So things have changed. There's been financial reasons why certain things happened and the way they came. We're seeing a slow shift. We don't want to see a pendulum. We want to see this slow shift so it's done correctly. And find people to be on your team that support what you're trying to do. Now, in this state, I can't do telehealth on the very first visit. I must see someone in person the first time. And then after that, I can do by telehealth. So I've had people, drive in, see me the first time, get their thing done, and we do the rest by telehealth. With Dr. Resnick, he's so good. Sometimes I just send him a picture. I'm like, Barry, what is this? And he's like, it's just this, this, and this, do this, this, and this. And thank you. Or do you need to see this? No, I don't need to see that one. So, it's a little different rules because I'm still a Schedule I drug. As it changes, if they make it a Schedule II, then I'll probably still have to see people. They make it a Schedule III. I think the laws will change, and then we'll see how it goes. So it depends on what's going on in your state, what the rules are, and doing it. But if you can't get access to cannabis, at least you can start with a good quality CBD.
Yeah. Can you explain, is there a difference between sort of recreational dispensaries and medical marijuana dispensaries? Somebody has asked a question regarding getting a card.
So it's very interesting. So in the medical field, it has to be a medical grade product.
Okay.
So it's a medical grade product. It has to be grown here in Florida. It has to be grown vertically. So you have to own the land, produce it, distill it, do everything you want to that plant, and do it in an organic way. Down here we have indoor grows and lots of ladybugs, because we have, when the humidity, we'll have fungus problems. So you get a good quality product. Unfortunately, in Florida, for some reason, they put a tax on it. And like, why are they taxing a medicine? I never understood that. So that's how they started. When it goes recreation, usually there's a difference in quality. There's a difference in the way it's grown, who has access, who can grow, who can't. In Florida, they're still trying to figure that out. But in other places like Colorado, when I lived there, we had this medicinal, and then also no one rec, and everybody was growing, and fungal infections and all sorts of things. And then usually there's a big tax on it too. So you have one cost here and then a cost 60, 70, 80% higher here. That does two things. One, most people would say medical, want to stay medical. They want a better quality for a cheaper price. Two, that gap leaves the ability for people to come in and try to undercut these dispensaries and sell it on the street or sell it illegally with a much inferior product that can have anything in it, fentanyl or anything else, which really happens if you start looking, if you've been to states that have gone all of a sudden from medical to rec, it's everywhere. And you're like, that doesn't even smell when you're walking down the street. So each state does it differently. There's usually a different quality, a different price, a different taxation. And then you have to see how it is. I think there's only 2 recreational states, if I remember, and the rest are either medical or medical and rec. So it's an interesting experiment across the US.
So we got a good question that just came in here. It says, as someone who's never tried marijuana, whether recreational or medical, where do they start? Is it safe to use in conjunction with Humira or Cosentix?
Barry, you want to start? Or do you want to?
Absolutely. Yes, absolutely safe. I don't know of any interactions. Granted, if we go on UpToDate or WebMD and we look at the interaction checker, you're probably not going to see anything about it. But I've never had any patients have any problems with it.
So here's what's interesting. We're clearing this thing in your liver, and it's called the P450 system, right? And then everybody who's in medicine goes, wait, everything goes through that. Of course it does. That's why people who drink shouldn't take Tylenol. They get Tylenol toxicities and different things. So I personally, in 7 years, haven't seen any interaction. The only interaction I've actually seen was a lab where people used to be on blood thinners before there's Xarelto and all the new ones, and they used to check your INR, and the number went up a little bit, but no one had a side effect. So we didn't know what that number meant, because was the cannabis interfering with the test, or was it interfering? We didn't know where it was, but there were no adverse effects. Now, in theory, yes, anything. If aspirin tried to pass the FDA right now today, I don't think it would pass. Too many side effects, too many different things. Now, that being said, you always want to monitor things. The beautiful thing about cannabis is there's a thing called an LD50. It's the lethal dose to kill 50% of the people using it, right? With narcotics, it's not that high. With fentanyl, we know it's very, very small. You talk about grains of sand. The LD50 for cannabis is smoking about 1,500 pounds in about 15 minutes. So we can't do that. Now, that doesn't mean it can't be done if it's done nefariously. So there's only one death that I know of that's linked to cannabis. And it was a mom a few years ago that gave her child an unbelievable number of gummies. These gummies were packed, and it would be well over the LD50 for anybody. And that's the only case that I know. So you can still say recreational cannabis, it's never happened because it doesn't shut down your respiratory center. That child unfortunately had a toxic event from other metabolites, not a respiratory problem where all those other meds do. So I've seen a great safe profile. Barry hasn't seen anything. We talk about it. We're like, it's the safest thing we've seen.
So can you bank on that? No.
No, you can't bank on anything because there's always one.
There's always the possibility, but so far in my personal experience, because that's all I can talk about, haven't seen any issues.
How do you guys advise patients, on, using marijuana either through smoking or vaping or other means? I mean, is there a preferable way that is going to have less sort of interaction or less negative side effects? Any way that you prefer you would see your patients using cannabis?
So here's what's interesting. As we were talking about in backstage earlier with cigarettes and tobacco and smoking. So there was an article that came out that said smoking cannabis can lead to heart disease and strokes. And I'm like, smoking blank, fill in the blank, the combustion of anything can lead can lead to cardiovascular disease. When, as Barry and I, correct me if I'm wrong, we were talking about cigarettes, it was the nicotine that was the problem, right?
For sure.
So everybody likes, some of my older users love to smoke flower. That's what they like. Some people say, oh, I'm done with that. I'm too old. I'm going on to other things. So people have to pick what works for them. And some people, inhalation route works better for them. And edibles do nothing. It's just like nothing. And some people are the exact opposite. They'll be like, I can't smoke anything, but I can eat a 50 milligram edible and I'm fine. It's just the way we are. It's that endocannabinoid system and how we react to things. Now, that being said, if someone's going to use flower, I personally would rather them use a vaporizer. They make vaporizers now that can bake the plant instead of burning the plant. So we take away the combustion chemicals that can lead to other cancers, right? Because you're talking about, does it make HS worse or does it put you at risk for other things? Now, inhaling anything is an irritant, bottom line. So vaping, I think, is better than smoking, less combustion. And then how your vaping changes too, because if you're just vaping flower, then you're just using the smoke. But if you're vaping with a cart or a vape pen that had to use an oil like MCT oil or coconut oil, then you're also getting sprayed a little bit with that. So some people cough from that because there's micro droplets. But I would always take non-combustion over combustion first, and then you have to look at, again, how long does it need to last? How quick do you need it? What combination? Some people have a lot of pain. They'll actually take an edible in the morning and maybe take a little puff of something to get immediate relief, and then gives them that 2-hour bridge. And then they can just put a little bit of vape on top. Some people, I have to wait till I get home. I do some drops at 6. I eat my edible at 8. I fall asleep at 10. I sleep all night. I take CBD during the day. Other people manage it differently. So again, the journal, understanding how the plant works and understanding how the plant works for you. And that's why I think it's a big elephant that people are afraid of sometimes, is take a little bite. And also the patient's in charge. And most patients are not used to being in charge of their healthcare. They're being told what to do. And what the beauty of this is, you get to be in charge. You get to pick. You get to see how it affects you, and you get to change it without having to ask permission.
So Dr. Resnick, we kind of touched on this actually a little bit before the webinar started, and somebody's asked the question, they're using a biologic, but they still have pain and they still need to take something for it. That's probably why they're, watching this right now. And they want to know why is that occurring, or why might that be the case?
Man, if we knew the answer to that, we would all go to the bank. The bottom line is that we are all not the same. Our reactions are different. Our reactions are different to CBD or THC. They're also different to Humira and Cosentyx and roflumilast and cyclosporin and all the things that we are using to drive the anti-inflammatory attack on HS. So when I talk to patients, I may have mentioned it, I pointed out that it is a medicines deficiency. And if I need Humira to get 75% of the way, and then I add cyclosporin and it takes us to 87%, but we've still got that 10 to 15% that we're still dogging, because every time I make you feel better, every time someone feels like a human being, that becomes a new reality, which is great, because I want to take you out of the depths of despair, that abyss of horror. I don't want to put you up on the cliff face, and then I want to take you up to the top of the mountain. So we're 3/4 of the way up the mountain, and we're really happy, and then a week goes by and you're feeling the same and you want to go to the top of the mountain. We got to keep on looking for other medicines that are going to help, and sometimes we need to change. So when you're talking to your dermatologist, just like what Paul was talking about, you need your team. I have a team. Paul is part of my team. I got a counselor as part of the team. I got a general surgeon who is part of the team. I had to create that team for myself. You need to create a team for yourself. You need a dermatologist who's going to listen to you but guide you, because I'm always telling patients, I recommend this, I recommend that, I think that this will do for you. I point out to them there are no guarantees in life except for death and taxes. but I can guarantee that nothing good will happen if we don't try. So getting back to your question, how do you make it take you all the way? It is trial and error. You know, sometimes I am sure patients feel like I am throwing stuff against the wall to see what sticks. Sometimes I am, but I'm throwing stuff that I know sticks some of the time. And I'm looking for the thing that sticks longest for you. And I also tell patients, man, my threshold for success is very low. If we are not moving forward to both our desires in 2 to 3 months on a particular medicine, I'm either increasing the dose, I'm adding something, or I am moving on to the next medicine. So you need to feel that confidence in your dermatologist that he or she wants to do that too, because we all want the same thing when we are sitting facing each other in the office or sitting across a screen from each other. I want you to feel better, because when you feel better, I feel better. When you feel crappy, I feel crappy too. So the bottom line is that you need to be open to change, and you need to understand that there are no guarantees, and it's hard and it's frustrating, and you're probably coming from 7 to 10 years of being told you're not this, you're not that, it's your fault. It's not your fault. And once you get past that, it'll be a lot easier to accept the help that you need. I hope that wasn't too long unanswered.
No, and I think, as a patient myself, expectation management was one of the things that, as I found physicians that were more experienced in HS and that were better suited to sort of treat my case and actually diagnose it, that was the conversation that was the most reassuring, was sort of understanding what are the expectations on both sides, and certainly, understand, and then also feeling hopeful that, like you said, there are more options. It wasn't just you only had this one arrow. There were multiple options, and if something doesn't work, we're going to try something else. And that was very hopeful. And so I think that's a wonderful message, for the physicians and for the patients to hear, and to kind of coalesce around that message for sure. I know we only have a few minutes left in the talk here, and I just wanted to just get both of your opinions on where do you see, acceptance of marijuana and cannabis as a medicinal treatment or a medicinal remedy in HS over the next, 5-10 years. If you were to look into your crystal ball, do you see this becoming more widely accepted?
You go, Paul.
Yeah, I do, especially when we look at this pain management, because remember that pain is exponential, and going from 1 to 4 is one thing, going from 6 to 7 is a huge jump. And so when you talked about the expectation management, you can't always get it all away, but if we can make that quality of life go better, which is what we're going for, I think when people quit hearing, oh, cannabis cure this, cannabis cure that, and that false narrative that's been around, and say, oh, it can help as an adjunct to part of the things you're doing. We're not trying to replace anybody. No one's saying don't go see Barry, go to your street vendor. We're saying use this as a thing. The other thing that'll happen is, if and when it gets descheduled, the amount of research is going to change. And that's going to be a good thing, real reason. Now, again, research is a bunch of individual stories, but hundreds of thousands of them to paint a picture, but your story is still your story. So if something's working for you, it's working for you. If it's not, make a change. So I think it'll open up. I think it'll be less stigma. I think more dermatologists and more doctors will come on board with it. I'm just hoping that they just don't use it as a panacea and start throwing it at everybody because it's easier, and continue to do what Dr. Resnick was described. Try this, try that, increase the dose, do this, use this adjunct, chip away at this thing until you can get to that quality of life that coming from the dark dungeon of the talks to the light. And even if it's not perfect, you can get to that good enough where people can have a quality of life.
It is hard to have HS, not have anyone to depend upon, and see light, even if it's shining you in the face. And I get that too. I look forward to the time when it comes off of Schedule 1, when it's legalized by the federal government. And we suddenly have a federal policy around it. It'll make it a lot easier to get. And I am surprised that my colleagues, dermatologists in my area, people with whom I train, people who I train when I'm at the university, they're not thinking about this as a medicinal product. I mean, I am reaching for everything in my efforts to make people with HS, to make people with psoriasis, make people with atopic dermatitis, all of these very chronic, really debilitating diseases, make them feel better. It's always the goal. And I think that sometimes physicians lose sight of that desire as well. And sometimes it's hard to find someone who's going to listen to you, but we are out there. And to throw a shameless plug for the foundation, the HS Foundation, we have people who are on the Clinic Finder who say, hey, I'm here, come see me. The more you talk about them, the more they're going to be found, the more people are going to want to go on that Clinic Finder. So to wrap up, I am pleased that we have brought some information to you. I know that a lot of you don't live in Florida, but I'm hoping that what we've talked about makes it easier for you to bring the conversation to your physician. And this is what I tell patients all the time. If your doctor doesn't want to listen to you or won't listen to you, find yourself another doctor. So, Mark, you want to take us out?
Yeah, I mean, I just, I want to thank both of you again for your time. We have a lot of great comments. A lot of people also, just expressing a lot of gratitude for you educating everybody. Certainly taking the time to make what can sometimes be a touchy topic into something that's very accessible, and also shine some light on other options, additional options, for patients and for physicians out there that may be listening. So again, thank you so much, both of you guys, for your time. Thank you to the HS Foundation for, putting on these types of events and raising awareness for the condition, and, just really being wonderful advocates for the patients out there. So, thank you both so much. Thank you everybody who was on, who spent an hour with us tonight to learn about a really interesting topic. We appreciate it. And certainly, use the HS Foundation website. There's a lot of really good information on there, great doctors listed on there. So look forward to many more events to come in the future.